Next up is Wiggl. I came across Dr. Mason many years ago. We crossed paths, and he is a superstar in the profession. Wiggl is a brand new startup out of the Bay Area, and they are taking the best insights you can expect from Silicon Valley and putting it in to practical applications you can use in your practice. They use functional assessments and AI tools in a way that is completely unique, beautifully designed. I think it's going to be really interesting for you. So without further ado, here's Dr. Mason.
Hello, everyone. My name is Dr. Mason. I am the founder and CEO of Wiggl Health. Wiggl Health is a AI-driven proactive solution for musculoskeletal issues for the workforce. A little bit about myself. I've been in corporate healthcare for over a decade, working for a company called Crossover Health. I've been treating and creating clinical pathways for top tech companies, like Applied Materials, Microsoft, some dimension. Been doing that for a long time, and it's been very fruitful and exciting, and which really led me into looking at how to be a service in regards to chiropractic and technology. As we all know, AI has pretty much disrupted every industry. There's not a day go by that you talk about AI. It's almost to the point from the inside, I'm tired of hearing it. Let's talk about the birds and flowers. Heading. But I'm really excited here to just kind of show you what we've been working on for over the last 4 years of building Wiggl Health, and how AI and wearables are creating some amazing outcomes that we can utilize as chiropractors. And at the end, we'd love to show you how we're also connecting and utilizing AI as a provider network and helping chiropractors, physical therapists, and ergonomists be able to get connected to employees faster within their network, so that they don't lose time and cause chronic issues. So with that said, I will just get started. I'm going to go over these slides really fast because I myself don't pay attention a lot when it comes to presentations that are long. So I'm going to make it punchy and fun. And if you have any questions, I have my email address. Please email me. Love hearing from chiropractors and seeing how we can make this great. So with further ado, let's get started. So already we could just start with the biggest problem right now when it comes to the employer space. This presentation is going to be more focused on how AI and wearables work within the employer space, because that's where the space I've been in and understand very well. There's a company called Locked In. They focus on benefits and they give stats and data on medical claims every year. Recently, actually last week, they just put out a new report on what are the healthcare trends of 2026. And what would you know? MSK is number 3rd leading cost of healthcare claims, medical claims for employers. It outbeat mental health. And I was so upset because I'm like talking to all these HR managers over the years. They've always kept investing into mental health issues, but mental health is not one of the top 5 leading healthcare expenditure costs. It's actually it's actually number 7, to be honest with you. And so when we look at what's going on is we have so much outside noise of we need to focus on mental health, in which we do. However, the big silent killer right now is still cardiovascular, cancer, and musculoskeletal issues. So I say all this to say this: there's a big need for us as chiropractors still in the employer space. However, we have to shift in how we are being needed, because a lot of the employers who are focused on benefits and wellness are trying to find better access for their employees to have care. And we have to look in that from a digital perspective now, because they're now shifting from, hey, should we have this on-site chiropractor, to, oh, if we can have this app that can connect us, that saves us money and gains access. And that's what we're doing here with the Wiggl Health. So there is a silent killer that's happening within MSK. Chiropractic is still needed, but we need to shift our thinking of how we can be at the forefront of this. Within that shift, we've starting to see that the solutions that are out there now, they're not bad. You have the physical therapy digital platforms like the Hinge and Sword. They've been very good at reactive care, cutting cost on surgeries and medicine. However, since the cost is still high, we're still needing to focus on more proactive care. I just had a conversation with a benefits broker the other day. He's like, Mason, look at these stats. The premiums are going up 40%. That's a lot for employers. Now that's cutting into the bottom line. And so he's telling me the conversations that he's having is companies are looking for prevention care because the premiums are going up. Now, obviously, claims are a part of that, but inflation is a part of that too. But they're really trying to figure out how can they cut that down. And so the old way of doing things have been more reactive, where someone has pain, you schedule, you wait, you get treated. That treatment plan varies based on the provider, and that is costing the company money, especially if you wait for it to be a chronic issue. But this new way is more focused on how can we predict these things from happening? Because if we can predict it ahead of time, we could shift the thought process of waiting to something be chronic and prevent it, which will save cost. And that's what we're getting into with Wiggl. Before I get into our secret sauce and what we created, I want to let you know that within the last 4 years, we have tested this out with some of the leading giants in the tech industry, like Meta, Amazon. We've even connected to some blockchain companies, and we are just partnering with a big benefits broker company called Benny to help us infiltrate this more into a lot of companies. So our solution is already proven within our partnerships, and we're continuing to build out this as a way of a leader in preventing MSK claims. I have to tell you, as we're focusing on as we're focusing on AI will come in with a wearable. I don't know if you're in the Silicon Valley or not, but we're already talking about robotics. That's the hardware to AI. And so when it looks like, when you're looking at AI, you got to see that there's wearables that are going to enhance the AI so that it can learn better. And right now, watches and rings are the thing right now. Over 53% of workers are utilizing a wearable. And watch and a ring is just not the only wearable. Even your phone has data there, or sensors, where we can collect the data. Your phone knows how long you sit. Your phone knows when you pick it up. Your phone knows your step count. All those different data points are already put into play. And by 2028, MSK will be monitored a little bit better than it is now. And we look to be the leading platform for that. So we're seeing these numbers with wearables and AI, fewer MSK claims, and faster recovery, along with helping employees have more productive days already, just by changing our behaviors and by giving employees better data and employers better data as well. So I will go in and show you how AI is transforming musculoskeletal injuries and how we as Wiggl Health are doing it. So this is kind of like our overall part of our system here. We have this thing in our company where our focus is delivering over 8,760 microchecks a year. And we do that through passive sensors. So that's like your wearable. I don't necessarily need to ask employees or users all the time of how's your pain, your range of motion. all that can be done through passive sensors and picking up different behavioral patterns. Now, where that separates us and differentiates us, should I say, is just imagine an employee comes into your office and you do an intake form. And then 2 weeks or 6 weeks later, you reevaluate that. A lot of things can happen within those times. And it's not to say that those are um, not valid assessments. We definitely still need those assessments. But the average person sees a chiropractor on average 4 times a month. So every other time in that month, there's a chance to get data. You always hear, a person will come back and say, oh, my back hurts. And then, oh, my back feels better again. Oh, my back hurts again. But the injury could be due to something different. And so when we have AI and wearables, we're able to create better outcomes through these passive sensors. We're able to do micro checks. We're able to predict things. We're able to give them personalized nudges. And one thing I love the most that I think chiropractic can shine on is we're able to connect them to care faster and connect them to the right care. So this is what we like to call our AI engine and our system and how we utilize Wiggl Health in the employer space. From that system, so think of what I just showed you as the brain of everything. It's like the back end of everything. This is the front end. This is what employees or users get to see. They get to see this screen where you have all your information about your data. Think of this like your sleep score. You have a sleep score, you have a fitness score. Well, Wiggl Health provides you with a musculoskeletal score. And from that musculoskeletal score, we're able to predict if you're going to have an excellent day while working because we know you're moving more throughout the day, or if you're having a long day and you're sitting in your chair, we're able to say, hey, tomorrow might be a little challenging. You might want to sit there and do some stretching, or you might need to see a chiropractor, or you might need to do some digital care, like do a low back plan on our platform. So we're able to predict injuries based on passive sensors. We're able to connect them to care. We partner with Aetna by providing Aetna providers on our platform. So we have over 12,000 providers nationwide that we can connect users to physical therapists and chiropractors right now. We plan on expanding that into other networks like Blue Cross Blue Shield, which we're in conversations right now, especially in Louisiana. And we're really focusing on seeing how we can make the insurance process more frictionless for the provider. Third thing is when it comes to the employer space and trying to tackle MSK, engagement is huge. That allows us to show if outcomes are improving. And so we not only focus on providing digital solutions and even a hybrid solution of connecting them to the right care, but we also provide them with challenges throughout their workday to get them moving throughout the day. So it might be like a stretch exercise challenge with their employees. It might be a step challenge, or it might be how many minutes can you do activities for that week. And this is all pretty much geared to really focus on improvement with engagement. The last feature that we have, which is really cool, that we're really, really excited about, is our AI chat. And again, AI is, if you look at AI, a lot of times people are looking at AI as just a chat center, whereas ours is a little different. We are communicating with your data from your wearable. So not only you can engage with a chat and ask question like a triage, anything dealing with musculoskeletal issues, ergonomics, all that, but we could take into consideration the data that we're getting from your wearables and actually have a conversation with you. And I think that's the cool part about where we're going with AI is a lot of times we are waiting for someone to have a conversation about their symptoms. Just a great example is when someone comes into your office and clinic, they're coming in because they have a problem, right? And they are then teaching you or telling you about their problem. But the beautiful thing about AI is we can pick up on data, trends, and whatnot, and start to have a conversation with the employee or the user before this becomes a problem. So this is a really cool feature where If we're seeing someone sitting for long periods of time, we can say, hey, we noticed you've been sitting for long periods of time without any activity. What do you think about we recommend you doing a stretch break? And that person can engage or not engage. And depending on the level of where they're at, that could be a high risk, medium risk, or low risk. That helps us decide where do we go next. Do we give them a digital solution or do we connect them to care right away? So think of our Wiggl AI chat as like a musculoskeletal triage / co-pilot. We call him Carter right now. So it's pretty cool. I'm finishing up here because I definitely want to show you parts of the platform, and I would love to talk to you more about what we're really building out in 2026 is what we like to call the Wiggl Connect. And this is where we are trying to really enhance and route employees and users to the right providers in their area. One of the biggest pain points for employers and HR managers that I talk to, they're like, Mason, we love the digital aspect, but our employees still want to see a chiropractor, but we need them to see the right chiropractor, or we need them to see a chiropractor in our network. And a lot of times when people are looking for chiropractors, they either are Googling or getting a referral from a friend. And that's not a bad thing. However, that costs a lot for the employees because if it's at a network, that claim is higher cost. And so what we've been able to do is partner with providers like chiropractors and physical therapists, and I can kind of show it to you in a second. But we want to verify them so that our AI system can make that recommendation to the employee of that provider. That's the future. If you look at how social media has transferred into verifying what is real and what is not, or who's who, you have a verification check mark, right? For if you're a celebrity or if you're an ex and you want to make sure you are not spammed or anything, you get verified. And just due to the fact of all the different conferences and medical conferences that I've been to see, I definitely see us shifting in a medical industry of verifying providers. And so from a physical medicine standpoint, Wiggl is the leader at doing this. Think of like ZocDoc. I know ZocDoc blew up by having all these providers. And I think ZocDoc was great. However, it's not really positioned to enhance the chiropractic industry, whereas Wiggl is really focused on chiropractic first and helping them provide the right utilization to not only the employees, but utilization to the provider as well. So high referral, pre-qualifying for real musculoskeletal data we provide, as well as helping you get higher visits within that. So I'll go ahead and show you that in a second. And we've already had numerous of doctors tell us like, man, thank you. This has been such a great help of being able to have this profile where not only I can be more visible from the digital world, but I can also even see how I can utilize my digital content for monetization on our platform. So it's pretty cool. Ending off, again, like I mentioned in the beginning, we've been really partnering with companies, and within that, we've had some case studies that have been very successful. Arch System is one of our clients that we've been working with, and when we first started talking to them, they were really heavy on the solutions for mental health and not having any solutions for physical health. And so they wanted us to come in and see how we can help support their company, because not only they were headquartered in Palo Alto, but they were a global company. They're all around the world, and they wanted engagement with each other, and they wanted to have something of supportive ergonomic support. And then lastly, they wanted to work on decreasing the claims. And we were able so far, and we're continuing to really impress them with the data that we are providing their team with, enhancing, 62% engagement just for thoughts, making sure they're also OSHA compliance with ergonomics, reducing claims by 40%. So really cool case studies that we've been able to do there. Um, I'm just going to really, I have this slide here, and I'm just going to just keep it simple. Um, I've had a lot of conversations with chiropractors, very mixed, but I will say this. The best way to say this is a couple months ago, I was at a conference that Stanford put on talking about AI and what does AI look like within the medical world. And obviously, it's very useful in the medical world. But I had a pristine medical doctor just pretty much say this. Anywhere in the medical industry, if you're not familiar with AI, you will be left behind. And I was like, I don't know about that. But over time of looking into that seminar, he actually was right. Here's what I'll tell you what the medical side is doing, and maybe that will allow us to see how we should operate too. And I wish I would have put this in a slide, but 63% of patients at Stanford actually preferred to utilize an AI system, LLM, over a actual human doctor. 63%. It was so crazy of that study. And if you want it, you could definitely email me and I'll send it to you. To a point where Stanford is looking to figure out how to utilize AI and robotics as an entry level for primary care within the next 5 years. And yes, you're probably saying, "Oh well, that's for medicine. That's it's supposed to be like that." However, the biggest thing that he said that really shocked me, like I'll say it again, he said, those medical doctors and those healthcare professionals who actually know how to use AI will accelerate within the next era of healthcare. And those who don't know will have a real tough time in any area of healthcare. And so I say this to say, is AI going to replace chiropractors? Absolutely not. But I will say that AI will enhance those chiropractors who actually know how to utilize it. And so that's why I'm so happy to be a part of this seminar, because we are really showing people the future of how to educate yourself in all different aspects, from EHR to marketing to communications to outcome, how to utilize AI as a co-pilot in your practice. And I believe if we are able to do that, you're going to see less burnout in our industry, more enhancement, more happiness, and you're going to be able to really love what you do. And I know there's a lot of things that AI can do that can help enhance our treatment skills and our business skills, all that. So I just urge everyone on here to don't resist it, don't fight it, but engage more into it. Ask questions. There's a lot of different workshops, even outside of this, that can really help you enhance your knowledge about AI and how to utilize it for the good of our industry. So, yeah. I just put this up here, and it's just echoing the previous slide. I could have just took the other slide out, but I actually believe we are living in a golden era for chiropractic. I believe with the ability of AI, wearables, and connecting digital content, we will be able to rethink the way we look at our practice. I think right now, even we're like a brick and mortar practice, but I think we're going to be able to reach the globe if we were to think differently. And that's what I'm trying to really focus on with physical medicine providers is how do we just don't look at the fee for service? How do we look outside of that? How do we blend in content creation and get paid for that? And even potentially get paid for that in our sleep. And that's where we can go with AI. That's where we can go with understanding how to shift our mindset from having to go in, having to see these patients. We are the greatest. They have to get this adjustment. I'm not against the manipulation and not against the adjustment, but I just go back to the point of even when we became doctors for the 4.5 years, I would say actually 2.5 years of our education, we literally sat there and learned so much. And we have so much great knowledge here that utilizing that into a digital content can get us paid beyond the 9 to 5 that we're doing. I think if we were to look at our practice from that perspective, we will be able to learn how to continue to progress the profession and this new it's like more of a tech era compared to the industrial era that we're leaving. So again, this is the golden era. This is not the end of chiropractic, but it could be a beautiful beginning for our industry. And that's where we're really excited at Wiggl to partner with chiropractors. We're really wanting to focus on how can we get these chiropractors within our network and utilize AI, utilize these technology, utilize your content to push out to people and partners of our network so that you're being seen. So being listed on Wiggl Connect is huge. I highly recommend you to sign up. It's really a great AI powered tool for referrals, especially when companies have remote or hybrid employees. And it's really going to just overall help you enhance your digital presence. So I have a QR code here, which you can take a screenshot and it'll take you to our Wiggl Connect page. And you can be able to pretty much sign up. And if you have any problems, let me know. You can email me and I can make sure we get you signed up. But you can create a profile. You can let us know within that profile, you're going to be able to let people know a little bit more about you. Think of it as if you're an Instagram person or you're a Facebook person, you kind of understand or see that person and understand their profile. This is the same type of concept, but now you can put how much you charge, being transparent, or what insurance do you take? What are you really good at? Are you good at, the cervical manipulation? Are you good at, lumbar manipulation? Like, just think about this, because at the end of the day, getting new patients is like dating. And so, you want to put the right cards out there so that you can have a good shot at that. And we want to help enhance that, especially when it comes to patient referral. So again, so you could sign up for that QR code and be able to be a part of our network as we continue to grow it. A little bit about our team. Again, myself, I've been at Crossover Health for over a decade. We've been into so many companies, I can't even list them all. I believe I was the third chiropractor in the company. And now we have over 200 to 500 physical medicine doctors. So that's including physical therapy, chiropractors together. So it's been such a great blessing to be a part of the company. I've learned so much, but I wouldn't be able to do Wiggl without our team. We have a product manager and our COO from Apple and our CTO who leads AI from Applied Materials. So we're well equipped to get this to where we need to do it. So again, thank you. I'm sorry if I bored you with this topic, but I really wanted to just come in here and show you where we're going within the future of AI and how chiropractic is so important in this next era that we need to think of. We really need to enhance our education in a digital perspective if we want to keep moving forward. And Wiggl is a part of that. And so we would love for you to just join us on this journey, whether if you want to be a partner, whether you want to be on Wiggl Connect, anything, please feel free to reach out. My email address is right there. But we want to hear more from chiropractors, because the more we're united in creating a digital platform, we can stand alongside the Sword Health, the Hinge House of the world, and we can feel proud that we have a digital platform that is pushing the narrative of helping preventing musculoskeletal issues. So Thank you very much. With that said, I'm going to stop sharing for a second. I'm going to show you our platform as a whole. And unfortunately, I did this uh, earlier. Uh, um, sorry. So I can't show you the app itself, but if you are very interested in seeing the app itself, one, you can download it. Two, we'll be more than happy to do a demo for you. So if that's what you like, we can do that too. But let me just show you from, yeah, I want to show you from the start, and we'll, sorry, I do look at TMZ a lot. Sorry. Okay, so here's our website here. If you get a chance, check it out. We are updating it this year, so more to come on that. But once you go to when employers log in, this is what they see with our platform. When employees download it, they're able to see a bird's eye view of which percentage of musculoskeletal issues is going on within their company. This is huge because some employers don't get their claims until the end of the year or end of the month or whatnot. So this kind of gives them a little bit of an insight of 41% of my employees have shoulder pain. And this is really good insights of saying, where do we need to spend more time as a wellness initiative to, decrease these types of issues. We have the Wiggl trends. You can see each month of where the trends are with workstation assessment, risk score, activity, pain, registration. When it comes to compliance, we built this compliance platform inside our whole engine because compliance is a big thing for companies. So we're able to tell you how many employees are healthy, at danger, or at risk. We have a famous ROI calculator calculating productivity loss, employee time, all that stuff. You can see how many active users, total users, how many nudges that we've done, how many employees that report discomfort. The biggest thing we love is we're able to share from a perspective of like globalization. Companies have to have, they have to understand what are other countries' laws and regulation when it comes to like OSHA, like ergonomics. And so we have every country in the world, what their laws are, what their regulations, what are the recommendations that are the requirements that are needed. So if they have employees in, Canada, we make sure that they know that they have to do ongoing ergonomic assessments and health and safety. We have a monthly report that is AI generated. And so it just pretty much tells a story of what's going on for the month of that month. And I love it because, again, it's a story about, just everything that you saw from the front page, but it's broken down into that month. So you see how many workstations been completed, how many assessments were done, how many assignments, how many assigned trainings were there, how many of them were completed, how many hours people were sitting, standing, steps, workouts, you name it. We have the data there for the employer. So it's pretty cool. If there was a chance that someone needed to have like an OSHA complaint, our system would auto-populate that for the employer. So it's really awesome that we're able to do that for them. And then I'll just skip to this one where organization setting. Some companies already have their own ergonomic setup. We can also provide them, their employees provide them with like solutions like a desk through our app. Unfortunately, I can't show you the app or it'll disconnect, but I would love to connect with anyone who wants to see it from that perspective. But yeah, it's pretty cool. I don't know if there's any more questions with that, but I will, one last thing, show you our provider list. This is our providers list where we have providers on there where if you wanted to connect with us, you could list your practice. This is where you would go to get started to list a practice, and it will auto-populate into our system here. But just to give you a high level, you normally we have this on our app, but we also have it on a web page. If you wanted to like sit there and say I have discomfort and then low back, then it will upload and then it would give you that recommendation. As you saw, it just said, hey, here's what you should look at is probably a chiropractor for low back discomfort. And it will sit there and connect you to San Jose Holistic Healthcare Clinic. You'll learn a little bit about them, their services, and this person has not activated their account yet. But if they activated their account, then there would be a little bit more information and personalization of the profile. So that just kind of gives you a little bit of an over highlight of our provider network that we're building, and we're able to allow us to give you that contact to that provider over time. We want to be able to show transparency of costs too, so that people are able to know what's a potential visit cost is going to be like. So yeah, that is our Wiggl Connect, which is our really just our way of building a community of providers like chiropractors. We have physical therapists on there. You can search it. It can come here and you can see where all these physical therapists are at on the side, and you can just learn more about them. So it's pretty cool of what we built. Again, you do the same thing for chiropractors, and it'll show you that on the map. So I'm really excited of what we built, and I hope that this is exciting for you in seeing how we are utilizing not only just AI, but technology, but just overall forward thinking of how we can push our industry forward in this new tech era. So thank you for the time, and I look forward to hearing from you all. And if again, you have my contact, and I'm excited to have you come alongside us on this journey of helping others out there. All right. Thank you very much.
If you want the best deals on products and services, along with some of the best speakers in chiropractic, you're going to want to register for our next summit coming up soon. Click on down below and register today.